So within our Bachelor of Dental Science honours, of course, you're going to learn the clinical knowledge and skills to be a dentist, but you're also learning a lot of other skills that will benefit you all throughout your career. So communication is key. It's important for you to communicate with your team, but also with your patients to ensure that, you understand and they understand exactly what's going on and what challenges they may be having. So communication is a really big focus of our programs in the Faculty of Health Medicine and Behavioural Sciences. Critical thinking, of course, you need to problem solve. So you will be developing those skills all throughout your program and research skills as well. So our program is an honours degree, so it does recognise that you will complete research within your studies, and it's also something that you could continue to do all throughout your career as a dentist as well, because there's new techniques coming out and new research that's conducted that may be able to improve your patient care. So it's not just the clinical skills and knowledge that you're developing. There's so many other areas that you will develop throughout your 5 years with us. So in year one, you're learning about a healthy mouth because, of course, you need to understand what a healthy mouth is. And so it's really integral as part of a healthy body. Um, you will really practice those fine motor skills. And that's often a question that we do get from students about how do I prepare before I even start my studies? And academics have said, if you like knitting, if you like those different kind of task where you will use those fine motor skills, they can actually be really great practice prior to you commencing in our dental science program. The image that you can see on the screen there is, we call them phantom heads. So they're designed to replicate a human face, and they feel like a human face as well. So it's really about you practicing your skills to ensure that you practice in this simulated environment, you make mistakes and you learn prior to going out and working with patients. I mentioned earlier about all the different disciplines that we have in our faculty. And the reason I mention that is because in the first year of your program, you'll undertake a course called Health 1000 Professions, People and Healthcare. And that's all about multi-professional education. And we have designed the course so that you're learning from students who are studying from other programs, who are studying physiotherapy, who are studying pharmacy, who are studying speech pathology. Because when you go out and work, say for example, in a hospital, you won't just be working with dentists, you will be working with all of these other health professions as a part of a team. So we are teaching students those skills from the very beginning of your program. So often the saying is students are learning with, from, and about each other. And I think it's a really great way to explain how, it's about our students coming together and, ensuring that they are developing those skills and understanding of how they can work in their best options as a team going forward in their careers. So it's really embedded from that first year of our program, and it continues throughout in different activities as well. The other thing that students will do as well is start the clinical experience, and that will be in peer clinics. So where you'll get experience looking in each other's mouths, your fellow students as well. So in year two, you'll continue to look in each other's mouths, and this is where you'll get in an introduction to other kind of minimal intervention type dentistry, including local anesthesia, where you will practice giving those needles to your classmates too. So that is something that you will learn because, the school is building your skills and abilities up prior to working with patients. And actually, in year two, you will be starting to work with patients. With this year as well, you will do some more advanced head and neck anatomy courses, immunology, microbiology as well, and also pharmacology. So you'll get all of this understanding, and particularly because you're looking at that dental management of medically healthy adults. When we move to year three, this is where you will broaden your scope of practice and you will get some exposure to other areas of dentistry. So, for example, prosthodontics, orthodontics, and pediatric dentistry as well. You will build on your clinical hours as well, so that where you'll get more exposure to patients throughout your program. And it's also the year where you'll complete specific research course. So you'll undertake a foundational research course, and this will then build for your following 2 years that you'll undertake in your program. So again, recognizing that the Bachelor of Dental Science is an honours degree. So all of our graduates are graduating with an honours class, and that's recognising your research studies that you've completed throughout your program. So this is where you'll undertake that foundational course. So year four, you'll continue to build those the knowledge and skills that you've developed, and this is where you'll actually develop a research proposal as well. So you'll have a lot of clinical time, and as I mentioned earlier, we have those dental clinics in our oral health centre, but you'll also develop a research proposal in an area of interest for you. So as I've got on the screen there, it will then prepare you for that capstone project that you'll undertake in your final year. So the final year, the fifth year, students, you get there, and that is 39 weeks of clinical practice. So in those final few years of your program, you will have kind of extended semesters compared to other standard students at UQ, and that's really ensuring that you're able to complete all of these clinical hours and everything prior to graduation. So 39 weeks of that clinical practice. And so some of that will be at the Oral Health Centre, but then other parts of that will be at other sites. So it might be at a rural or regional area in Queensland, or it also could be at other clinics as well around Brisbane. So that will allow you to continue to develop those diagnostic and clinical skills. And the aim is that you do encounter all facets of patient care by the end of that fifth year, so that you've been exposed to a lot, so that once you graduate, you do feel prepared for working as a registered dentist. As I mentioned as well, you do have a research project, and that is actually a year-long course.